Good morning, ladies and gentlemen. A very, very special and warm welcome to Berlin for the World Health Summit. My name is Christine Mhundwa, and I have the great pleasure of steering us through what I believe is one of the first sessions taking place at this year's World Health Summit. For those who've come from far, a very warm welcome to Berlin, and it's great that we have a full house already as we kick off this session on responsible AI in health for sustainable development. I feel like in every conversation we're having, in whatever sector you might be in, we're discussing the impacts that this technology will have on the work that we do. And as a health community, how we can better deliver healthcare to our communities. So this panel, or this session, ladies and gentlemen, is co-organized by the German Federal Ministry for Economic Cooperation and Development, locally known here as BMZ, as well as the HealthAI, which is the Global Agency for Responsible AI. Ladies and gentlemen, we know that this technology, artificial intelligence, holds enormous potential to transform healthcare, but it also carries real risks if it isn't governed properly. So over the next 90 minutes, we just want to get into a discussion where we can explore how countries, how regions, how global actors can collaborate to ensure that AI is ethical, that it is inclusive, but that it is also sustainable. And this morning, we're honored to have State Secretary Niels Arnen. He's State Secretary in the BMZ. He's going to be delivering our opening remarks before our panel discussion kicks off. As I said, he is State Secretary at the German Federal Ministry for Economic Cooperation and Development. So over to you now, State Secretary.
Well, thank you all, and good morning and welcome to Berlin. I was told I should address this camera, so it's no disregard to all of you. Good morning as well. And first of all, I wanted really to thank you all for being here. It is really great to see you. And for Germany, I think I can say that this summit has been of great importance. And I also want to congratulate, we are just in the beginning, I want to congratulate the organizers. I think also this new setting is fantastic. So really looking forward for the next couple of days to address important issue. And one important issue, of course, is the question of AI. Because just a few weeks ago, Nobel Prize winner Demis Hassabis said in an interview, and I quote him, "AI will be 10 times bigger than the Industrial Revolution, and maybe 10 times faster." As The Guardian pointed out, Hassabis Nobel Prize in Chemistry demonstrated what AI already can achieve. With his research, he was able to predict the structures of proteins, the very building blocks of our life. This innovation can open the door to countless medical advances that will reshape the way we live. But just like the Industrial Revolution, opportunities come with risks, misuse, bias, and the unintended consequences could undermine patient safety, and also very important to address here, public confidence. This means, ladies and gentlemen, we must carefully consider governance, we must carefully consider ethics and trust as we integrate AI into our health systems. With this in mind, let's look at two examples of how AI and health go together in practice. In many of Germany's partner countries, AI-supported diagnostic tools are transforming the way healthcare is delivered. With the help of AI, doctors can detect cancer much earlier, giving patients faster access to life-saving treatment. One of our partner countries as BMZ is Cambodia. In Cambodia, BMZ has supported a project that uses AI to improve the diagnostic of cervical cancer. This is making an important contribution to women's health. More than 10,000 women have already been screened for cervical cancer under this initiative. And simultaneously, AI is changing the way countries manage their health systems. both governments and international organizations in global health, we know that, unfortunately, are under fiscal pressure. That will also be addressed here in Berlin. But there is also an opportunity. I mentioned that. Digital health and especially AI can help countries to work more efficiently and to make most of the limited resources. I want, with your permission, add another example of our development cooperation. So take Nepal, where BMZ is supporting the development of an AI module in Open IMIS. This is a digital system that manages health financing. And this AI-powered system accelerates the processing of health insurance claims. And this means that patients get replies more quickly and insurance companies save money on the administration. And all this, ladies and gentlemen, dear colleagues, shows AI is not just a promise for the future. It is already saving lives, improving efficiency, and reducing healthcare costs today. But as I mentioned in the beginning, there are also risks associated with AI in the healthcare sector, and we need to use the World Health Summit here to address them as well. Imagine a pregnant woman in a rural village who has been waiting for medical advice for a long time. Finally, she receives medical advice. Finally, she receives her diagnosis on her phone, maybe through an AI-powered chatbot. And for a moment, this fills her with confidence. She can access healthcare without long-distance travel or high costs. But the diagnosis is based on data trained maybe thousands of miles away, in a context very different from her own. The treatment recommended is either unavailable in her country or potentially harmful for her unborn child. Or, which is also very likely, unfortunately, it costs more than her family makes in a year. So, ladies and gentlemen, if AI is misused or poorly regulated, or if it uses the wrong data, it can produce biased diagnosis or offer incorrect treatment advice. It can ultimately put patients also at risk. And those risks go beyond individual patients. They also affect global equality. Because, ladies and gentlemen, unequal access to AI can deepen existing disparities between countries and regions, leaving vulnerable population even further behind. And I think we all agree, we cannot allow this to happen. Every country and every patient must have the opportunity to benefit from safe AI in health. Moving forward, this requires partnership. That's the philosophy of what we have been doing with our partners over many, many years. Firstly, governments and the private sector must cooperate to make AI safe, fair, and accountable. Clear standards and robust oversight are essential, not only for the safety of patients. They also allow companies to confidently invest in the development of AI softwares in countries worldwide. And secondly, since AI in healthcare is advancing globally, multilateral cooperation is key. Only then can innovations benefit all countries and meet shared ethical and safety standards. So BMZ supports international partnerships. For example, with Africa CDC. We just had an excellent meeting, and I'm happy that you joined the stage. And we partner, of course, with the World Health Organization to strengthen regulatory systems for AI in health worldwide. Non-state actors like HealthAI are also very crucial and play a critical role in these efforts. They help countries and regulators to ensure safe and ethical market access for AI innovations. So HealthAI is the trusted partner of BMZ. And I would like to commend you for your vital work that you are doing and for co-hosting this panel here today. I also want to give a big thank to all of you, our distinguished panelists here, for enriching today's discussion with your invaluable experience and diverse perspective. I think the discussion could not be more timely, and it's great that we are having this first big public discussion on this issue here today. And I think also patients will listen very attentively with their expectation toward us, because it's our responsibility to deliver. So thank you all very much, and back to you. And thank you also here. Thank you.
Thank you, State Secretary. There's German timing, and then there's Niels Annen timing. Spot on. 10 past the hour is when he was meant to be finished, and he is done in that time. All right, so ladies and gentlemen, we're going to get into our panel now, a bit of a panel discussion. And I just want to already invite you to prepare your questions, because we've allocated time for that towards the end of our discussion. So note those questions, because I really want to take as many as possible. It's also a cue to my panelists for them to keep their remarks succinctly enough so that we're able to engage in a discussion with our audience. And of course, a huge welcome to those of you joining us virtually as well. I would like to now introduce my panelists as they'll join me up. First is, of course, our Honorable Dr. Jean Kisea, who is the Director General of the Africa Center for Disease Control and Prevention. So right next to me there. Thank you so much. Dr. Alain Rubrique is the current Director for Data and Digital Health Analytics and AI at the WHO. If you could please sit there, Doctor. If you could take the seat there. Thank you very much. Claire Bonnell is the Vice President for Global Partnerships at Siemens Healthineers. Thanks, Claire. You could take that seat over there. Dr. Christoph Ben is joining us today as Chair of HealthAI, co-organizer, of course, of this panel. So that's your seat there, Dr. Ben. And last but certainly not least, Isaac Jenny, who serves as Senior Advisor for Health Digitalization at the Indonesian Ministry of Health. Thank you very much. I guess I'd like to start with you, Isaac Jenny, because give us a sense of what you see as the most promising opportunities for AI to improve healthcare for citizens in Indonesia. So that's the first part. And then maybe, where do you see the biggest risks of unregulated or perhaps misregulated AI in this context?
Thank you, Christine. Hello, everyone. Okay, so AI in Indonesia, here we are, I think we see it as a very critical to enable our healthcare to become equitable and sustainable. So basically, I give you three things that highlight three things that we already doing. Yeah. So the AI will be now is becoming the bridge of the access gap between the city and the rural. Yeah. Basically, because in our city, in our rural actually, we have a very limited specialists in Indonesia. Yeah, so then, because of that, yeah, with the AI, we can do a lot of things. Yeah. Something like imaging interpretation, early screening, decision-making tools, and everything. And AI will make our healthcare workers in rural area to be able to get the specialist level capability, basically. Yeah. So it's going to be helping Indonesian healthcare to not only improve the quality, but also improve the access. That's the first one that we are doing. The second one actually is AI currently in us is already helping in administrative works. For example, in our hospital, we need to do a reimbursement to the national insurance. Yeah. Yeah. So basically, the AI will help to mapping all the clinical pathway between the insurance and in the hospital. So what happened is, based on the last 6 months, we are doing AI for the codex of the hospital. Yeah, we are enable the hospital to reduce the reimbursement pending from around 25 to 30,000 to become only 17,000. Yeah, because the AI will will see the data. If the data is not complete, then they will see in the application that you still need this kind of data. Yeah. Before the patient leave the hospital, you know. Usually, if you do the codex after they leave the hospital, you cannot get the data anymore. But before they are still in the hospital, you can still get the data. Yeah. So that's the second one. Actually, what we're doing with AI. The third one is actually for the public health intelligence. At this time, starting around mid of February, Indonesia is doing the large-scale screening program. We have around 270 million population, and we want to screen them once a year, basically. Yeah. Just before I come to this stage, actually I checked that we already today 39.5 million. Yeah, basically around 2 billion or 3 billion records of the data, actually. Now, when we screening them, yeah, we get all the data that come to us, and we are using AI to analyze the data and give the guidelines on how people continue with their work. I mean, they need to get the sport, doing this sport. They need to watch for their eating and everything. That's what we build. We take the data and we put everything in the AI. So that's the things that we are doing in Indonesia at this time with the AI. And regarding the problem, yeah, the risk, yeah, actually, the first risk actually is what we are seeing is the bias of the data.
Right.
I think we can agree that most of the data is the AI trained against the Caucasian, either the Caucasian, Chinese, or Indians. Yeah. So basically, Indonesia is actually one of the largest biodiversity in the world because we are in the crossing of each race in Southeast Asia. So I talked to some of the AI company. Yeah, they said, for example, the chest X-ray. Yeah, for example, yeah, they said the chest X-ray is the same all over the world.
Yeah.
Yeah. They say whether it's coming from India, China, it's the same. So our testing actually provide the same result. Yeah, but probably from other AI, the other form probably not that much. Yeah, probably. So that's why we need to train the AI using our own data actually.
Right.
For some other things. Yeah. That's the first one.
The bias. I think let's leave it there for now, and we'll come back to the other risk. But I think that bias risk is something that many people will be able to relate with. But to you now, Dr. Kaseya, could you give us a sense of what the current landscape is of AI governance across the African continent and within the AU? Also, where do you see the room for improvement?
Yeah, thank you so much. You know, we started to discuss about AI in 2022 in Africa, and we released the AU Continental AI Framework in 2024, and now we are working to have a digital transformation agenda that includes AI that will be approved by the AU Assembly in February 2026. Why we are doing that? Because when we are talking about AI, different countries are approaching that differently, using what we call entry point. In some countries, health sector was not the entry point. It was the trade that was the entry point. But how can we bring that together? For us, when we talk about AI, and it will be also the way how to improve that, we think about 5 key areas. The first one is policy. You cannot implement AI without strong policy at national level and at continental level. Because each country must give us what is the understanding of AI and what they want to do. Mm-hmm. The second one, we are talking about infrastructures. Do we have appropriate infrastructure? Now we have Siemens here. What kind of partnership we can have with Siemens and other companies, mostly the private sector, that can help to build this infrastructure. But when we say having that, it means the third one is funding. When I talk about funding, I talk mostly about sustainable funding. Let me be clear and loud. grant will not bring us anywhere. We need to think about funding that is coming from this mechanism. Now we are working with Kenya on how people can contribute by getting some percentage of health services to maintain and to sustain these initiatives, because we cannot go every day to Germany for grant. This is not acceptable. Maybe it will be just a push, a little push. I see State Secretary is laughing, but I'm honest. This is what I'm saying to my leaders every day. Yeah. And we talked about policy, we talked about funding, we talked about infrastructure, but human resources, human workforce, we need to train them. We need to make them from the community focus to health centers to national level, how they can use this AI. I don't want to go to impact of AI as my brother from Indonesia was sharing. It's everywhere, but we need the human with the center. And the last one is the regulatory process. Yeah. This is critical. How to ensure that we are not victim of cybersecurity, how to ensure that we are honing our data, because today, African countries, we are not honing data. This is another revolution that we are bringing.
Okay, thank you so much. And I think we'll come back to that point later in the discussion. But to you now, Dr. Ben, because at HealthAI, you're sort of working at this intersection of global frameworks and then the local implementation. How can international standards be effectively translated into national policies to accelerate the adoption of responsible AI in healthcare?
Thanks a lot, Christine. And at the beginning, allow me as chair of HealthAI and co-host of this session to thank State Secretary Allen for a very, very powerful address, very inspiring, and also thanking you for co-hosting this event together with HealthAI. It's really wonderful to see this partnership with BMZ and GIZ, the technical agency, as well. And I think you already mentioned some of the key aspects that we are discussing here. I think any of us here in the room understands the huge potential of AI, right? It can accelerate progress in an unprecedented way. It can save costs, as you also alluded to, right? It can make health systems much more efficient, but as the State Secretary also said, is what we need is also public confidence and trust, and we need to manage and mitigate the risks. And that's exactly where HealthAI comes in. So we need international standards and guidelines. And to be very clear, they're not coming from HealthAI. They are coming from our partners at WHO, at other international organizations, OECD, ISO, and so on. But then the challenge is how to translate those standards at the country level so that it can really be applied. And that's where HealthAI comes in to kind of build the capacity. I think just as you said, Dr. Kaseya, at every African country, we want to see the capacity being built, right? So that the countries can regulate and validate and certify themselves what might be appropriate, for the use of these kind of very promising tools. And that's the kind of bridge that HealthAI wants to build. And there are many different activities, but it is very clear that we can only manage these very complex processes together. And that's why HealthAI has created a global community of practice, and more than 400 partners are already part of that, in more than 70 countries. And I'm very happy to say that basically all of our panelists here represent partners of HealthAI. It starts with WHO, of course, absolutely indispensable in this effort, and Alain is sitting on the board of HealthAI, I'm happy to say. But also to you, Dr. Kaseya, as African CDC, an absolutely critical partner. And I think we shared the kind of vision that we would like to build together the capacity in all the African countries so that they can make the best use of the tools that AI provides. Indonesia is already a partner. We have been in close exchange with the Indonesian government as a pioneer country, and delighted that Indonesia, like other countries, is joining that. And also with the private sector. And Claire, wonderful to be on the panel with you. Siemens Healthineers, in a sense, stands for many private sector partners that are already part of this community of practice and partner of HealthAI, because only together we can manage that. And the final kind of point, you talked about equity and values. in your opening remarks, and that's what we want to get at. Right now, we are not living in a very equitable world when it comes to the application of AI. It's extremely unequitably distributed around the world. And I think all of us here, not just on the panel, all of us in the room at the World Health Summit and the larger community, I think that's our task, that's our job, to make sure that everybody benefits from this progress and that we accelerate the equitable access to AI tools in health. Thank you.
Because what we don't want is for this technology to exacerbate our current inequalities. But Claire Bonnell, it's really great to have the private sector's perspective in this conversation. And what would you say are the responsibilities of the private sector when it comes to AI governance?
Sure. I think maybe in order to understand what our responsibilities are, I think it's important to maybe demystify a little bit what AI is and how we are using it in the medtech industry. I'll give a very short example. Imagine that you're Thank you. Imagine you're a patient that needs to undergo imaging on your brain. You would normally go into an MRI, and it's an exam that will take about an hour. Now, with AI, coupled with other technologies we're able to reduce that scan time by up to 80%. What it means in practice is that you may be a patient that's uncomfortable sitting in that tube. It means that we have reduced times then for you as a patient, reduced waiting times for other patients who are waiting on their exams as well, improved workflows for the healthcare providers, but also ultimately improving patient outcomes. And I'm saying this because I think it's important that we try to connect a little bit the reality of AI with the global governance frameworks. So I think we're all in agreement here to say that AI serves patients and health systems, the huge potential and the opportunities it offers to all of us. Our primary responsibility as a medtech is also to be able to scale the technologies and AI, making sure, again, to your point, Christoph, as well, around equitable access, making sure that everyone, everywhere can have access to technologies and to better diagnosis. I think from a global governance perspective, I think we can only deploy if we build trust. We talked about this. Resolve also the fragmentation of the current AI ecosystems. We have to understand that the industry is actually facing different issues in different legislative environments. So we don't have currently a global governance framework that would allow us to deploy at scale. Our responsibility in that deployment of technologies is also looking at how we do this responsibly throughout the product lifecycle, looking at trust, safety, and transparency into every stage of AI development. We've been doing that for over 20 years at Siemens Healthineers, and we've been leading globally in patent applications for medical imaging. And we always try to do so by balancing risks to patient safety, privacy, and equity, with also the need to advance innovation. Throughout that, we maintain core principles. I think some of them that you may be familiar with, but we see that AI is not replacing healthcare professionals, it's helping them do their work better. We're also looking at how we can handle data while respecting individual privacy and transparency. For that, collaboration with policymakers, providers, and patients are essential to build these capabilities. Ultimately, we try to create an ecosystem where we safeguard patients and public trust, while also using the transformative potential of AI to improve outcomes, accelerate innovation, and ensure, again, that we build equity at the center of everything that we do.
All right, thank you, Claire. Dr. Lubrica, I want to come to you in a moment, but I think I just want to capture some sentiment from the audience here. And let's see if we can just do a little bit of an audience survey. I've noticed that a lot of you have your mobile phones with you, so perhaps you can put them to good use for now. There should be a barcode coming up onto the screen if all goes according to plan. And what you would then do is turn your camera on, and point at the barcode exactly. And then we've got a question for you there. Where do you see the main challenges when it comes to AI governance in your country? So I'm actually just going to see myself up here if it's working before I... Okay, so then there should be a link. So just one word would be fine. It should take you to... Yeah, so you can enter a word, a second word, a third word even. Just give everybody a moment to do that. I'll invite you guys to take part in that as well. So where do you see the main challenges when it comes to AI governance within your own country? All right. So the bigger the word, it just means more people are using that or are writing that word, basically. So regulation is, as we can see, the main challenge. I want to see if I can see some of the other ones. Okay, now it's getting really small. Well, to those of us with very good eyes, we can make sure. But what we need are really the big ones, right? So it's the equity, everything that's come through in our conversation so far, regulation, the funding, the equity, the policy. So to you now, Dr. Rubrique, because I wonder if what you're seeing here in this word cloud is resonating with the experience that you're having at a WHO level. How is the WHO supporting its member states in strengthening the governance of AI? We see that regulation, funding, policy, all of these things are the challenges people
I think it's also challenging my my eyesight because it's getting smaller and smaller by the moment. So my wife keeps telling me I should bring my glasses to these things, but I think our previous speakers and the fact that regulation sits there in the middle of the screen speaks volumes to the fact that regulatory environments are not inhibitors to innovation. And I think this is something that in the past, private sector and the media has often cast regulation as being the big bad wolf in the room. And I think when you hear from Dr. Kaseya, you hear from member states, regulation is in fact that which creates the environment for private sector to thrive, right? When you look at Siemens and other corporate partners who want to play a role in building a public health response, it's not the public sector alone in many countries that responds to public health crisis. It's a combination of public and private responses. And I think having a clear, well-governed, clearly regulated environment speaks to the maturity of that ecosystem to intake innovation and bring it into the fabric of the health system's response. But let me reflect on when you ask the question of how does this coincide with what we're hearing from countries. In January through March of this year, we launched an emergency survey to assess the impact of the sudden decline of overseas development assistance on our 194 member states. 41 countries, I'll say that again, 41 countries, many of them in sub-Saharan Africa and in the global south, experienced catastrophic, if not dramatic, collapses in fundamental digital health infrastructure systems that were in place for claims reconciliation, for patient care, for decision support at the front lines, for supply chain management, for essential life-saving drugs, whether those are HIV or TB or malaria. And it really, I think, was a wake-up call to all of us that, as Dr. Kaseya said, that foundational investment, not the one-off grant to build a shiny object, but the investments, and I think State Secretary, who was there just a moment ago, mentioned this as well. We have to invest in robust foundations, governance, policy, infrastructure, and capacity before we can truly reap the benefits of digital health or artificial intelligence. And so although we are experiencing collectively this sense of FOMO or this sense of FOMO being fear of missing out, we hear about AI all around us and we think, oh, if we don't start this tomorrow, we'll be missing the train. But in fact, 25 years of investment in novelty technologies has shown us that those novelties don't persist beyond the duration of their short-lived funding unless the country has the sophisticated investments in infrastructure, governance, that we see in countries like Indonesia, we see in countries like Rwanda and Tanzania, who have spent decades investing in that backbone capacity. So governance and regulatory environments are paramount right now when WHO is talking with member states in the things that need to be built up first before we can truly have safe and effective artificial intelligence. The other piece I'll just mention very briefly is nuance. AI is not AI is not AI. We have to be cognizant that there are artificial intelligence tools that have been around for 2 decades. Pattern recognition, you mentioned diagnostic imaging, and yourself, Dr. Kaseya, you mentioned the fact that we can accelerate administrative functions like claims adjustment, which are not sexy to talk about in the media, but they bring huge value to health systems. They can drop cost of healthcare. They can make health workers more efficient. So I think when we talk about AI, there are frontier technologies that are at the interface of the patient care equation, but there's also things way up in the value chain that are massively impactful on a health system's cost and efficiency that we should be investing our time and energy in first.
I think it's easy to style a journalist, the robots and those pictures, to the point you're making, that kind of exciting visually stuff. To you again, Dr. Kaseya, what capacities are needed across countries and within institutions to ensure the safety of patients as it pertains to AI? And what role will Africa CDC play in advancing the governance of AI across Africa?
You know why I like this kind of dialogue? I will not read what my team prepared.
Oh, wonderful. Thank you.
I will share with you
Yes.
my own experience.
Yeah.
You know, when I started my career, I was medical doctor somewhere. They call it Kaemba, in southern of DRC. I was the only medical doctor for 250,000 people.
Oh, my goodness.
250,000. And without capacity on RX diagnostics, I was making miracles to diagnose honestly. And sometimes I was doing surgery where it was not recommended because I wanted to know. And I learned from that. I said, how can we improve? Yeah. And later, I will share with you what I saw in a country that is building more than 200 hospitals. They wanted to invest to buy radiology, diagnostic capacities somewhere. Millions of dollars. I had to bring these people in UAE and Qatar. What they are doing, the innovative way. They are partnering with the private sector. They are putting in place the governance, the regulation process. The private sector is investing, and the government is even getting money from this investment. What we are saying today, Africa will move toward this model. There is no way for us in Africa to continue to have people dying while they can have access to medical doctors, to appropriate diagnostics using the AI tools. There is no way for us to continue with corruption, fraud, because we are buying through middlemen some of these tools, while we can partner with the private sector and to have appropriate mechanism, governance, to ensure that things are moving. This is what Africa CDC is doing today, to bridge the gap, to link countries with private sector, to make sure that the governance is in place, regulation process is in place, and to work with WHO at global level to see how they are leveraging on that to make sure that we are moving. I think when I see Siemens, we'll have a dialogue because I have a market of 1.4 billion people waiting for the PPP to be in place. Thank you.
Thanks, Dr. Kaseya. You want to come in, Elon? Yeah.
Yeah, no, I think, I mean, this, I second your notions as well, that this is the kind of challenging, but I think realistic dialogue that we have to have more of, right? We have to understand how to compartmentalize the hype and talk about, you know, the pregnant woman in DRC or in Bangladesh who's experiencing the healthcare system with all of its flaws and challenges, and how these tools will fit into those existing systems. So building regulatory environments is certainly one aspect of this, but the other aspect that I think, as we think about what's missing, is the benchmarking tools. How can governments be equipped with the methodologies, the tools, the systems that ask the question, is this technology appropriate for my context? will this technology perform in the way that the vendor is claiming it will in this context? How do I empower physicians, decision makers, policymakers with the differential diagnostic capacity to say, this is a good tool, this is not a good tool? But even more than that, is this a tool that I can afford and that can be sustained locally in this context, that will not create a vendor dependence for years to come because I've invested in a shiny dream today? So there are tools and resilience mechanisms that we need to invest in now so that we don't continue to see these unacceptable deaths of women, children, families, due to preventable things that we can diagnose early using some of these exciting technologies that are at our fingertips.
While we still got the mic, we opened the conversation about inequalities at some point. So how can international cooperation then in AI governance help to reduce global health inequalities from a WHO perspective?
So there's an F word that we all like to go to, and that's fragmentation, right? And you thought I was going to say something else. Come on, everyone knew I was going to say fragmentation. Fragmentation is when good intentions get in our way of actually reaching the most people in the shortest possible time. And regulatory fragmentation is one where we can imagine, because of the lack of harmonization across regulatory agencies, if regulatory agencies, like Christoph said earlier, are using different standards, different benchmarks, different tools, technologies that are being introduced and are heavily promising in a country, let's say Nigeria, and neighboring countries can't rapidly evaluate and adopt that technology because they have a discordant harmonization process, then we will see years and years added to each technology. And it will be a disincentive for innovators and the private sector to play in that ecosystem. So I think one important tool, and this is one of the things that HealthAI and WHO has been playing a very strong role in, is in bringing the regulatory environment together, bringing regulators from different parts of the region as well as the world together to discuss these issues. While these policies are still plastic, while we're still trying to understand, are there global norms as well as national or regional norms that we can use to actually assess and evaluate these technologies? What are the policies that need to be in place for risk assessment, but also responsibility? Yeah. If an AI goes wrong, who's to blame? And how do we legally allocate that responsibility to either the user or the producer of those technologies? So I think getting the conversation going across regulators is absolutely a critical part. The other part is knowledge sharing, and I think the aspect of learning from each other on what works and what doesn't work is going to be a critical step. And I think HealthAI is trying to develop some of those tools to share knowledge across this ecosystem.
Yeah. And Claire, just coming back to you, the role of public-private partnerships in supporting regulatory capacities across regions and countries, what do you see as the role of these PPPs?
Yes, I think, I think we have, I wouldn't be doing a good job as a head of partnerships at Siemens Healthineers if I wouldn't say that public-private partnerships are essential, in my opinion. I think that PPPs can help us really bridge the gap between innovation and governance, ensuring that technologies can be safe, effective, and equitable, as we all said. I think there are two voices here that matter when we look at public-private partnerships, equally important. Industry, we bring the real-world implementation experience. We know firsthand how AI delivers impact, whether it's early detection of Alzheimer's or breast cancer. We know also where risks emerge in clinical settings, not just in theory. We understand also the innovation pathway. We know what's technically feasible today, what will be coming in 2 years from now, and also the constraints that exist in scaling the technologies. On the other hand, regulators bring the frameworks, the public mandate, the accountability as well to the public, and so much more. I think both voices are equally important at the table because in the end, we all are looking at it from the same angle. We're looking at how can we improve patient safety, trust, and outcomes. Let me give you a concrete example of a PPP, which I think is actually quite effective. There were a number of technologies that were entering the UK market where existing regulations in the UK were actually not designed for, were designed for traditional medical devices, not for ones that are evolving like AI is. AI is different, it learns, it evolves. So we need a different regulatory environment for this type of devices. The regulatory agency in the UK launched what they call AI Airlock, which is basically a sandbox. It's a safe tasting space where companies can bring their AI products, and at the same time, regulators can examine them closely. This is all while the products are still in development. But what it helps us do here is that we see the concrete example of industry bringing the actual technologies, how we can look at real AI systems, show how it performs in clinical settings, while regulators look at it from a legal perspective and really making sure that the safety, the frameworks, any risks that we might miss, the public accountability is there. I think with this, we can learn how regulations are both protective and practical before they turn into actual law. At the end, I think regulations and global governance is actually key to help us keep the pace with innovation while protecting patients. And this model is now, the UK example is now being replicated globally, really making sure that countries can build the regulatory capacity faster by also learning from each other's sandbox. At the end, I think we have an obligation here and also a common foundation that we can use by working together, industry, government, agencies like WHO, where we help prioritize transparency, accountability, and responsible innovation to build patients, to build confidence with patients, healthcare systems, clinicians, and the broader public.
Yeah, and to you again now, Isaac, Jenny, just staying on that thread. Governments and global initiatives like HealthAI, as well as the private sector, how these can best support countries like Indonesia in developing effective and inclusive governance for frameworks in AI health?
Yeah, actually not much different from what my colleagues told. So basically, at this time, we spoke to some of our friends in the private, actually, that we are doing what they cannot doing. Yeah. For example, actually getting the data is taking too long for them to talk to all the hospital and then asking the ethical clearance from all the hospital. Yeah. We, for example, in Indonesia, we have around 38 big hospital. So we get all the data. We check all the boxes regarding the ethical clearance, and then we create the sandboxing, like in the UK. Yeah, we learned from the UK actually. Yeah, so, and then the sandboxing, we invite all the players to start something like clinical trial for AI, basically clinical trial. That's why we need the capacity building and knowledge sharing from the HealthAI to make sure that our data actually is good to as a trained data or as a learning data for the AI. So basically, we say that to the private actually. Let us do our job as a government, yeah, to collecting all the data, and then you can do a testing of your algorithm and everything in our sandbox, something like that.
Okay, and I guess back to you then, Dr. Ben. How are you helping countries overcome the challenges of the implementation of AI regulation that we've heard about?
Yeah, thank you. And I think I can build on lots of the comments here from the panel, but let me mention a couple of concrete initiatives that HealthAI has been taking. The first is HealthAI has built what is called a global regulatory network that countries can join and learn from each other, because only together you can, really establish your regulation at the country level. And that is not a question of, high income and lower income countries, big countries, small countries. All countries are invited to join and have joined already. Smaller countries, high income like Singapore and Uruguay, or large countries like Indonesia, India with a huge population, but also high income countries in Europe like the UK, and then many countries, in Africa, Asia, Latin America, because all can learn from each other, and you need that global regulatory network. And there will also be a lot of South-South cooperation, because one thing that HealthAI always says is it's not a one-size-fits-all. Yep. I mean, you have the global guidelines and standards, but then it needs to be applied locally and nationally. And that is very kind of specific for every country. So HealthAI is not there to prescribe anything. HealthAI is there to kind of help countries build that capacity and work with the teams and the respective regulatory authorities. So that's one thing. The second is also an early warning system. That is something I think we need to kind of think about as well. We all have that in the pharmaceutical sector. You know, if you have a drug and there's a side effect, there is a method that everybody will be alerted to if there is a risk. We don't have that in the AI space so far, so we need to kind of build that together. But also a third aspect that I think is very important, HealthAI is building a global directory of those AI tools that have gone through the assessment of the kind of existing rules and regulations. And if they are approved and certified, then there is a market, right? I mean, we are talking about access to market here for many companies around the world. And it should not just be a privilege of, you know, some huge giants in Silicon Valley or other huge countries. But there's so much ingenuity in basically every country. And I've seen that traveling for HealthAI, you know, startups in every country. You know, bright minds who create these tools, but how can they get that to market, you know, without knowing even whether their tool is acknowledged and validated and, you know, adheres to these standards? That's, I think, what we want to build. So it's not stopping the progress, just the opposite, right? We need strong regulation and trust in the system so that also the kind of the private sector innovation can thrive and can be scaled up. But to do that in a way that it applies to all countries and not just to a few who can really invest the billions of dollars and have the capacity. I think that's our job, to kind of make sure that this can be done in every country around the globe.
A very good point you're making there about the trust element of all of this. We have to ensure trust in these systems. Thank you, guys. Why don't we turn to the audience now for some questions? I already see some. Quite a few. So what we have to do now in the time that we have is make our questions very sharp, direct them to a single panelist, one each, because there are quite a few hands. Now, I know that somebody has a microphone. Hannah, would you come around this way, because we're going to start here with the microphone. So number one, please, ma'am. So I'll collect 3 questions at a time. So where are the other hands? Okay. 1, 2, 3. Up front here. But sharp. And to one panelist, one question. So we'll do 3 here. Thank you.
Thank you very much for this enlightening session. The AI health, the more I hear about the AI health, it's like an additional technology to enhance diagnostic tools. I want to hear more about the use of AI as such in terms of managing and enhancing the resilience to climate change crisis. And this is very critical because whatever you do, enhancing diagnosis alone is not the way out. So we have not heard about that and how it's linked to sustainable development, if you don't mind.
Thank you. And ma'am, where are you from? You're presenting?
Major D, Professor of Environmental Health, American University of Beirut.
Okay, Beirut. Thank you very much. And if you could give the microphone to the lady in front of you. Thank you. Just a quick intro of who you are and to which panelists you would like to.
Thank you so much. My name is Natalie. I'm the Youth Council member and advisor to the Minister of Health of Ukraine. And my question would be, what are the skills the present generation of policymakers are lacking, and what kind of skills the young generation should have and you should invest in order to avoid any other issues connected to the AI? And I think I will go with the WHO representative on that. Thank you.
Thank you very much. Yeah, hello.
Yes. Hi, thank you so much. I'm Jojo with the Mother and Child Foundation from Nigeria. I have mostly my question relating to WHO as well as HealthAI. It's most specifically with policymakers. How can policymakers design agile yet ethical frameworks that protect minors without stifling innovation? Thank you.
Thank you very much. So I'm clear about the last 2 questions, but who's going to take the first one? I wasn't sure who that one was directed to. Okay, in the meantime, we'll start with you, Ellen, for yours, and then we'll figure this out.
Sure. And in any conversation, I think there's always a dark underbelly that we have to confront if we want to make true progress. And I think our professor's question about the environmental impact is one that we definitely have to come to terms with. The hope is that as technology progresses, the environmental impact will be attenuated. We're seeing some forward movement in that direction, but currently the resource hunger of some of these large models is something we cannot ignore in the face of the climate issues that we're dealing with. So it's a bit of a double-edged sword, but one hopes that as these technologies become more efficient, that aspect will be addressed. But I think to address your question head on, I think part of the promise that we're looking at is AI's capacity to integrate many different facets of complex data at the same time. So integrating the realities of climate change, population migration, the market and economies with the rise of infectious diseases gives us a unprecedented type of insight into forecasting epidemics, into forecasting non-communicable disease risks in populations. So I think there's both pluses and minuses that ethicists and policymakers will have to debate going forward. But on the question of capacity building, that is foundational. And as Dr. Kaseya pointed out, without that human capacity, we can forget about artificial intelligence capacity. WHO has been leading coursework on building those foundational capacities among policymakers. We've had about 30,000 people across the globe taking those foundational courses. But it's important to learn about how these systems work. I think for many still today, AI is a magical black box that has the promise of solving and addressing a lot of problems. The more you understand about how AI works, the nuances of the different types of AI models, and understanding sort of when to be skeptical of the results and of the promises of the vendors trying to sell you a solution. I think it's absolutely critical that policymakers have that skill set of knowing what questions to ask, who to bring into the room to help with that decision making, and understanding where the limits of hype and the limits of reality currently are.
Dr. Ben, if you could pick up on.
Yeah, I'm very grateful for that question about the health and climate change, because indeed it's very easy for all of us to understand the role of AI in diagnostics and imaging and so on, and there are lots of examples. But the big challenge for the future is how to build climate resilience health systems. And there, I think the use of AI tools will be huge. Maybe it's not so much, on our mind yet, but if you think about how do you want to know where are the most vulnerable, areas in a country and the health system that is, prone to, be affected by extreme weather events, then we need the use of satellite technology, other technology, and AI to analyze that and propose how we can make health systems much more resilient. So I think this is already kind of an emerging area, but it will be even much bigger in the future. And in the end, honestly, there will be no area of the provision of healthcare, of planning health systems that will not be affected by AI, right? It's not that there will be a few tools here and there. The digital transformation of health systems and the use of AI is the way how health systems will be kind of implemented, planned, and financed in the future. The question is how we do that. That's, I think, what we're discussing here.
Did you want to weigh in, Dustin?
Yeah, quickly on the second one, then on the third one. When you are facing more than 253 outbreaks per year, and most of them, 70% of them are linked to climate change. This is why we need to use the AI tool for climate resilient programs that can prevent these outbreaks. I think we are aligned with what our colleague said and with what Christophe said. On the third one, regarding policymakers, I'm dealing with them on a daily basis. Politicians, when you talk about AI, the first thing they have is fear. Fear. Where the data will be stored. Who's regulating all of that? Is it a body somewhere or it's at national level? How can I ensure that there will not be cybersecurity? This is what we are doing to help them to understand what is AI, to help them to understand that they will regulate that.
Yes.
And what will be the infrastructure, what capacity we need to build, and what is the advantage to have that. I think these are skills that we need to equip policymakers for them now to make appropriate decisions. And the last one, will not move in Africa of AI if we don't have strong health insurance scheme to maintain that as a sustainable way to move on. But this is another discussion we can have later.
Okay, let's collect another round of hands. I'll come to this side of the room. 1, 2, and 3. Right. So again, if we could keep our questions short and to direct it to a single panelist. And a quick introduction of who you are.
Thank you. Short and very specific question for Christoph. My name is Mukesh Chawla, now with the UN Foundation. A few days back, I found myself with a bunch of pessimists, smart people, but die-hard pessimists, therefore very dangerous people, who argued that AI is beyond regulation. And they painted a doomsday scenario, which I shall read out very quickly in 3 sentences. Opaque algorithms and very deep black boxes will quietly decide who gets health care. Global firms control national health data. AI-driven misinformation erodes public trust. Efficiency replaces empathy. And the very tools meant to heal actually end up weakening the foundations of public health. I would like you to please dispel this worry from my head at least, so that I can go back and respond to them. Thank you.
Thank you. Okay, so it's the lady behind.
Thank you so much for this wonderful section. My name is Ogechukwu from Nigeria. I'm the founder of Cecilia for Empowerment Foundation, where we integrate AI to improve maternal mortality and menstrual health literacy. So my question is coming from grassroots perspective. I want to ask, in Africa, Nigeria as a case study, to get data to be able to analyze and to help to improve pregnancy complication, we find it very difficult. So now, how can we be able to integrate this AI to the local level that we're talking about? Because it's not always about the policy making, the governance. How can we get the data? Without data, we cannot make informed decisions. So this question is directed to Dr.
Kasea. Got it. Thank you. And one up front here.
Thank you very much. Good morning, everyone. My name is Ricardo Leite. I'm the CEO of HealthAI. Christoph Ben's the chair of our board, so he's my boss technically and officially. So always nervous talking in front of your boss. But I want to say that this has been a very important discussion. Probably also focus how artificial intelligence will be critically important if we get it right on the prevention side. And so rethinking our disease-driven model of care, which is not sustainable, towards transforming health systems, which can be driven by artificial intelligence. And of course, innovation will only move at the speed of trust. As Christoph has mentioned, and the global early warning system that HealthAI is building with regulators around the world is going to be critical in terms of post-market surveillance. However, there's also the issue of scale. We see a lot of pilots, but we'll end up with a lot of pilots that do not lead to systemic transformation if we don't fix some of the critical issues like the issue of health technology assessment and reimbursement of the technology. Somebody's got to pay. And we see that governments haven't been able to crack that nut, and it's critical. And I want to leave a question for Dr. Kasea. We've spoken a lot. We see here in the European Union that there's an EU AI Act. There's a tentative regional approach. You're leading the Africa CDC. I know you're in intense discussions with the African Union. Do you believe there is a role for a regional approach also, and that bodies like the ACDC and the African Union can play in the future of AI for health? Thank you.
Okay, thank you. You did something I don't want the rest of you to do, the long soliloquy before the question. So don't follow his lead in that front. And then, and you'll do that question very quickly. But I want there was a gentleman here. Please, if you could just pass, yes, a quick question from you.
Yeah, my name is Mesfin Tassama from the International Rescue Committee. My question is, how are citizens and users are participating in terms of feedback? I think this is for a speaker from Indonesia. You know, from here, we talk about the high level, the upstream. What about the users? Today, many people experience AI from fake news and all those kind of, misinformation, all type of things. So how is that going to be dispelled and make sure that they are comfortable and be able to use the data?
Okay, we come back here. Dr. Kasea, we can pick up with you, and then we'll just go around the room.
Quickly on data, and hope if a regional entity can lead this agenda. My friend from Nigeria, you are right. Let me be more concrete. when USAID stopped support to African countries, the next day, they lost all data. I think it's known by all of you. Then we started to think, do we have to continue with this model of data owned by others? And for any political reason, we lost our data. Without data, we cannot move with this agenda of maternal and child health. Without data, there is a trust issue. This is why, even in Nigeria, with Minister Pate, with all other ministers, we are rebuilding, this is what I call the digital transformation agenda. We are creating now national intelligence centers in each country. We want to own our data, and we want to open this data to all stakeholders like CSOs and communities to know what is going on, to start to monitor the progress. I think this is the way to move forward. Linking that to what I know we had several discussions on that. EU is pushing this agenda of AI. AU, we are also pushing this agenda. We believe that there is WHO at global level giving guidance, policies, but we are the owners of this AI at continental level. This is why I told you, now we are working with all member states on this digital transformation agenda that will be adopted by the AU Assembly. It will be launched during the AU Assembly in February. This will be the main framework of AI implementation in Africa, led by Africa CDC, supported by African Medicine Agency for the regulatory aspect.
Thank you, Dr. Kaseya. Dr. Ben?
So I will try to address the question about being pessimistic or optimistic here, and it would be great to hear the views, all of you here. I personally would call myself a realistic optimist, and I think if I was not, I shouldn't be in this business. But at the same time, all the issues that you mentioned, are not without any kind of reason, right? We have reasons to be quite concerned about some developments and whether indeed all our efforts in terms of the guidelines, the regulations, the capacity is fast enough to keep up with the kind of enormous progress. And you can read lots of books about that, and there's no guarantee that we will, remain in the upper hand, if you like. So, but I do think, first of all, we have to do our utmost to kind of regulate and build the trust. And I do think we have the tools, we have the partnerships to do that. So that makes me a more realistic optimist. But very briefly also to the comment on the role of citizens and users, because I think that's an important one. Not every citizen, can become a specialist on AI and could, form an opinion on how we regulate AI. That's not necessary. We don't have that, by the way, in the pharmaceutical sector either. I mean, if you're a patient, you're prescribed a drug, then normally you would trust, doctor, your pharmacist, that this drug has gone through rigorous, trials and, has been validated. But if you do want to know what the side effects are, you can go to websites and so on. You can read about that. So probably we do need to invest also in educating and informing, I think, citizens, and then in the end, their representatives in parliaments and legislators. But not everybody has to become, a specialist in that. But we have still a long way to go to build the trust of the public that, jointly in our networks and our partnerships, we do have the tools so that they can trust in the end whatever comes out of an AI-driven tool benefits their health and their health system.
Okay. Isaac Jenny?
Yeah, regarding the feedback from the people, actually. Yeah, so basically, nothing. It's only good at this time. Yeah, because not many of people know that this is done by AI. For example, yeah, I mean, usually they get 2 hours for the image interpretation. Now they get 5 minutes. Yeah. Usually it took 2 weeks or 1 month to get the result from the insurance. Now it took only 3 days. Yeah. So actually, today is not. There is no negative on that one, but there is one negative we see at this time. now most of our citizens upload the lab result to the AI commercial. Yeah, just to get the and result is very good actually. Yeah, I mean they almost everybody just upload it to the. I'm not saying the name. So basically, yeah, you know the name. So basically, what we are doing now is we are building the big LLM base for local. We hire 200 doctors to create the big open source LLM, taking the base, and we create for the nationwide LLM, so people can upload to our system. Because this is very important that when they upload, they can get the trusted information. I think that's all. Yeah, thank you.
Okay, I'll come back to this side of the room. 1, 2, 3, 4. Very quickly.
Thank you very much to the panel. My name is Tony Togun. I'm a professor of global health at the London School of Hygiene and Tropical Medicine. And my question will come to you, my brother, the Honorable Dr. Jane Kaseya. No, you. Like you, I'm an AI optimist, recognizing the enormous potentials of artificial intelligence to improve healthcare. However, what is the African CDC doing to get stronger buy-in from the African governments to increase their investment in healthcare infrastructure in Africa? Because the health system is the platform or the foundation upon which you can build any successful or sustainable AI. And if the healthcare system cannot even provide basic, affordable life care to the most vulnerable people, now, how do you put an AI on that?
Well noted. Number 2, next to you, sir. Yes.
Thank you. Thank you for sharing your experience with us. Professor Dr. Yusuf Baran from Turkey. I'm Professor of Human Genetics and Director of Izmir Institute of Technology. So my question is to the panel. Who want to answer?
So you have to pick one person.
Then WHO.
WHO.
Okay. So there are significant inequalities in all around the world in access to the internet, to the food, to the water resources, to the health services. So what do you think about AI in health? Is it gonna increase the inequality or will contribute to fill the gap?
Okay,
thank you.
The mic goes there.
Thank you. Thank you, the panelists, for this wonderful talk. It has been very insightful for me. My name is Justice Angbad from Robert Koch Institute. My question is directed to Dr. Ian Kaseya. And I want to ask about, so you mentioned about the AI framework that was established in 2022 in Africa. So I want to ask, how is that particular strategy trying to be prioritized, like to support things like health equity that has also been mentioned, as well as data sovereignty and also local capacity within the African continent? And also, how are these being done with respect to mitigating possible risks also that could challenge the landscape, I mean the implementation of the landscape, such as maybe algorithmic biases that could exist and stuff like that. So those are just what I wanted to get clarity on. Thank you.
Thank you. There was a fourth hand. Yes, please.
Hello, everyone. Thank you for the insightful discussion. My question goes to HealthAI Christophe Ben. Based on the question, on the comments by WHO in terms of benchmarking, how do we ensure that countries are asking the questions, will this work in my country? What do I need? And I know that you mentioned there's a knowledge sharing hub. So how are these materials developed or put out in a way that ensures that the context is actually there, so that Nigeria doesn't pick what Rwanda is doing, but the context is very much different. So how are you ensuring that the knowledge and resources that you're putting out there is actually providing enough information on the context, and maybe even helping stakeholders or anybody interested in building AI for a particular location gets enough context or questions to actually ask before adapting to the country? Thank Thank you.
Okay, we'll come back. Dr. Labrik, we'll start with you. I still have to get to that end of the room for questions, so let's just bear that in mind as we answer now.
Sure. So I think Dr. Baran actually brought me back to the dystopian scenario that our earlier colleague raised, Dr. Mukesh. Yes, we could be looking very much at a dystopian scenario if we don't have these discussions now and we don't work to invest in strengthening national regulatory capacity, invest in making compute available to researchers and innovators across the planet, whether they live in the north or south. I think there are inequities that have to be addressed structurally, but as Christoph mentioned earlier, I think we can't afford not to look at digital transformation and AI as ways in which we make our health systems more efficient, given the limited resources that are available. Currently, when we look at a frontline health worker broadly across the global south, the workers that are the primary caregivers in most communities spend anywhere from half to 2/3 of their time filling in documentation and paperwork. That's not a proper use of anybody's time, let alone in a health system where there is inadequate human resources to provide health care. So I think we come back to those low-hanging fruit and the importance of identifying which technologies can help free up the resources so that we can provide care more equitably to populations that deserve it. But there's another word that we haven't used in any of our conversations today. I just want to make sure we mention it, and that is an E word. I said an F word earlier.
Now it's an E
This
word.
E word is evidence.
Yeah.
And, we have professors and doctors and clinicians and students in the room. Evidence has to be foremost in our thinking when we look at how we invest in any technology. And Ricardo brought up this point of updating the health technology assessment mechanisms, but AI is not evidence-free. When we make decisions on spending limited resources, they have to be driven by evidence. So just a few days ago, the AI Evidence Alliance for Social Impact was launched in South Africa with the help of UK and Canadian resources. And I think Africa CDC was part of that initiative, but really bringing back to the forefront the importance of asking ourselves, are we doing this because it's a shiny object and because it makes a headline, or because it achieves a political goal, or is this a useful investment of limited resources that we have? And does it impact lives and health outcomes? And that has to be at the forefront of our thinking.
Okay. Dr. Ben.
So I want to address particularly that question, on benchmarking, information sharing, I think very important. I think there are a lot of very credible sources of information, and, WHO is offering lots of information. You can go to the website, other organizations, OECD, UNESCO, and others. So there's a lot of information out there. But the question is, of course, how do you make sense of that, right? I mean, there's almost too much information, maybe. So just from the perspective of HealthAI, maybe two tools. One, I mentioned the community of practice might be the right kind of entry point, and check that out. As I said, more than 400 partner organizations in more than 70 countries. Because you need that platform where people can also exchange their experience and their view, so that it's really kind of country specific. And another tool maybe to mention here that HealthAI also has initiated is the HealthAI Navigator, an interactive, step-by-step digital guide designed mainly for policymakers, but can also be used by others. So there are lots of tools. I think what we are trying to do is maybe to kind of present that in a way so that it's more accessible, for people in different contexts and so on, that will inform them, because they're also the ones who will kind of then inform others, like spreading the information out so that it finally reaches also the citizens and users. Thank you.
You have to.
Thank you so much. These two questions are aligned. How to move from policy development at continental level to implementation at country level with more support or more engagement from countries. I will shock you. I will be provocative. If there is someone in this room who's considering ODA cut as a blessing, it's me. ODA cut is a blessing for us in Africa. Because I was talking with a minister before ODA-CAT. He had 12 initiatives coming from Western countries, different organizations, without interoperability at country level. He was unable to follow the progress because these tools were not talking to each other, because the government didn't invest. Now, with the ODA-CAT, I have the strong voice to say to our countries, we still have policy, even if we are working to the new tool, but this policy exists. How can we now have people implementing that with the government ownership? This is what we are doing currently in Africa. We are not waiting. Yes, we still have support, as we saw in South Africa and in other countries. Rwanda is doing a great job. I think you are following what Rwanda is doing. Now we have more ownership. This ownership is coming from innovative financing that we are generating from countries. Now we are applying some taxes. You know, many countries are showing Ethiopia, Ghana, even DRC. Now we are building our own programs, and partners are just coming to support. This is what we need. And I will challenge myself first. I'm saying before the end of my term, I want to see how African countries are honing this digital transformation agenda, including AI, and they are making impact, and they can say, we are proud of what we are doing with our own resources.
Thank you. Okay, so last round of questions. From that end of the room, oh my goodness. Okay, oh guys. Okay, so ma'am in the back, 1, 2, 3, 4, 5, 6. Please, short and sharp. Here's the thing. I'll be transparent. We have to finish at 12:30 in 9 minutes. So bear that in mind as you ask your question, and to my panelists, as you 6 people, let's go. We can do it. Come.
Okay, so hello, I'm Iris from Taiwan. I'm also representing the Young World Federation of Public Health Association. So I have a question for HealthAI. So we're talking about responsible AI. So my question is responsibility allocation is a really important topic, especially in clinical decision making. So from the regulatory aspect, how can we build a trust for local healthcare professionals to really use AI confidently while ensuring the responsibility is clearly and fairly distributed to the governments, the AI itself, and the health workers, and even the industry?
Okay,
thank you.
Thank you. Number 2, where's number 2? Quickly.
Hello, my name is Harpreet Singh. I am a CEO of new startup in Germany and holding a master's in international health management. And my question is to you, sir. As you all are talking about the AI and its benefits and what are its pros and cons, but nobody is talking about how to get AI expertise. That is the base. So a nation like Africa, if they are making their own expertise, or you are still depending on Siemens, like the private partners. So this is my main question.
Okay, thank you. Number 3.
Hi. First of all, thank you so much all for your experience in speaking on this panel today. My name's Aisha. I'm a nurse and also studying digital health here in Germany. My question is for resources. Dr. Kaseo, you touched on this quite a bit, but when it comes to the fair distribution and equal distribution of resources, that when AI, as it does progress, how are we kind of addressing to ensure that a budget is not necessarily getting in the way of actual global implementation for country-specific and globally? That's my question.
Thank you. Number 4 was somewhere. Thank you very much.
This is a question for Mrs. Bonnell for the private sector. My name is Rafael Garcia from the Center for Global Health Diplomacy based in Geneva. And the question is, how do we convince the private sector to be on board with regulation, especially in Europe and in other countries, where entrepreneurs in the private sector see that as a barrier, given also that the main poles of innovation, US and China, have been disregarding regulation for the responsible use of AI.
Good morning. My name is Andrzej Rysha. I'm representing Friends of Health Global Fund Europe. So my question goes also to Claire from Siemens. and also to Isaac from Indonesia, just pick up
Just one.
Okay. Difficult, but I will tell you why. What is the way you are working? We are having vibrant community of startups, across the world. How do you harvesting, and bringing this community to you as a company or to you as a ministry?
Thank you. There was one more hand here. I said 6. Oh, yes, it's the gentleman right here.
First of all, thank you very much for this captivating discussion. I'm Gaspar, I'm from HMST. My question is quite simple. We have been discussing a lot about the future benefits of AI, but right now AI is already having some cost. And our goal is to be efficient, so we need to consider both. Do you think, and this question is raised to the WHO, that we can tackle with regulation the cost of AI that are ecological, human resources, and also, I would say, energical, and to take that into account in how we are calculating the benefits?
Okay, thank you. Claire, we'll start with you. You have two.
Thank you for the question. I think it's true that there is a little bit of a mindset shift here that's needed, where we think, okay, regulation is a barrier, it only adds more burden and more policies. But at the same time, we also see it as a way to help us ensure the framework, build the trust, build the public accountability. So we are not against regulation. We just think that it needs to be done in a way that allows to balance what I was mentioning earlier, between balance the risks to patients, ensure safety, ensure privacy, while also keeping up with innovation. Clear example is the EU AI Act, and you mentioned in your question the difference with China and US market that have been more open about this. For us, the EU AI Act certainly adds another layer of complexity. The main issue there is how do we build that into existing legal frameworks in a way that doesn't conflict, that helps us actually keep the innovation, make sure that we deliver on the health outcomes that we want to reach, and at the same time protecting patient safety. So I think it's a key question around the competitiveness as well, right? We want to make sure that companies, whether startups or more established companies, large ones, can ensure the delivery of health outcomes and make sure we keep the competitiveness in place. So my one word on this would be, yes, regulation, but it needs to be done in a way that helps us deliver, not blocks us, and make sure that we can do that together, that we can shape the regulatory systems, that we can shape the legislative frameworks by listening to the voices of the entrepreneurs, the startups, and also the larger companies.
Dr. Ben.
So maybe first to the question of the colleague from Taiwan. So first, you asked about, how does it filter down in the clinical decision making, right? So HealthAI is quite aware of, how advanced Taiwan is in terms of, developing AI tools, but also in terms of regulation, right? I mean, we are aware of the kind of regulatory authority in Taiwan and so on. So we're probably one of the most advanced countries with the highest maturity level when it comes to digital and AI. So therefore, probably there's not much, that international organizations can teach Taiwan in that sense. It's maybe the other way around. You're probably a very good model, for many others. But your point indeed is right, and it almost relates to the other question on how to, get the appropriate level of expertise in AI, because I think both questions address the question of teaching, also academic teaching. How will this topic be included in the kind of teaching of all health professionals at all levels? And that, again, that's a kind of question for every country, and they have to decide that. I think what we as international organizations, the only thing we can do is to provide maybe the right material that can then be translated into national and regional curricula, for health professionals at all levels. But certainly I think you're probably a very good model for that. Thank you.
Thank you. Dr. Kaseya, you can take it.
Thank you. How can we ensure equitable access to AI in Africa? Yesterday I was reading an article. Switzerland, they're implementing an EU policy for all foreigners. My passport will never be stamped again from 1st of November when I will enter Switzerland and EU countries, because they are using an AI tool that is accepted at EU level. This is what we are doing in Africa. We are creating a platform, a continental data repository. And we are having what we call the data sharing agreement with each country. It means at country level, all information they are getting will be shared, first with Africa CDC, I'm talking about health, then with other countries, and will be at the same level of information. That is critical even for researchers, for pharma companies, for everyone, because we are benefiting from 1.4 billion people. That is helping us to prevent spread of outbreaks. That is helping us also to be more proactive when there is an issue. I think this is how we are using the AI tool. And my last word will be for our colleagues and partners, bilateral mode is not the best way to move on. Let us work at regional and global level. I think you understand and you read my message between lines.
We do. Okay, so your question has not been answered, but I give you permission to approach him at the end of the session and get your answer from him, if you don't mind, because we've hit 12:30, and the issue is there are other sessions, and out of respect for the other programs that are happening and everyone else's networking, let's leave it here. Thank you to my panelists very much, and to the audience as well. Thank you.